様こんにちは。健康医学院の沈再文と申します。今日はですね、治療法ではなく、一つ面白いテーマをちょっと皆さんに紹介したいと思います。この、西洋医学の先進国ですね、カナダでも自然医学を注目されているということですよね。1987年、私はね、阪大で、医学博士の学位取ってからちょっとカナダ行きました。カナダ一番大きな都市は、トロントとちょっと100キロぐらい離れている一つ大学都市ですね。グローフというグローフユニバーシティ、この大学の中で、生理教室でポストドクター博士後の研究1年間でそこで研究しました。翌年はですね、私は自分で、グローフと、トロント2つの場所で、開業しました。その時はね、Chinese and Japanese Health Institute という中日健康センターという、中日健康研究所という、いわゆる2つのクリニックを開いてです。主な内容は、アキュパンチュアの鍼灸ですね、針と、気功と、それから漢方薬ですね。そこで、2つの都市で、開業したです。その間はですね、いつもカナダ各地、あるいは、アメリカ、特にのミシガンという州がですね、よく講演に行って、その中では何回、カナダのテレビの番組も、出演したですね。今日はですね、皆さんちょっと見せたいことは、私はカナダで、テレビ出たところのこの番組の様子をちょっと皆さん見せたいと思います。ということは、カナダでは、もう自然医学ですね、注目されている様子をこの番組見ていただいてご理解できると思います。カナダとアメリカが、一番近い国ですけど、医学もとても発達しているんです。いろいろないいところね、日本では国民保険、向こうは全国民が全部医療保険があります。だから医療保険ということは、日本では1割から3割、カナダはね、無料です。診察も無料、薬も無料、入院も無料、入院の食事も無料、ほとんどの医学は無料です。ただ、良くないところは、目と歯の治療が、自分のお金で出さなきゃいけない。もう一つは良くないところは、日本では自由にいろいろ病院で行けますけど、カナダは一つのファミリードクター、家庭お医者さんところを診察して、もし必要あれば、ちょっと大きな病院を紹介して回していくという、時々はね、待つ時間がすごく長いです。びっくりすることで、日本では考えられないですね。例えば、一回耳の炎症が起こってですね、ちょっとファミリードクターのところに入れて、ちょっと紹介してくれ、大きな病院で1ヶ月ぐらい待ってくださいという、いや、1ヶ月ぐらい待つと耳が聞こえなくじゃないかなという、これはちょっと良くないところです。医学の条件としてはね、病院の条件もとてもいい。国は全部国から出している、病院だから、とてもいいの条件で、もちろん医療設備も医療技術もとても進んでいます。しかしこんな状態では、皆さん元気かなと思うでしょうね。しかし私も向こうで、約6年間で、このアキュパンチャークリニックを開いて、いっぱい患者さんが接触して、もうこの人の病気も多いですね。西洋の人はでっかな体はね、しかしいろいろ病気が多いです。腰の痛みとかね、いろいろな病気がちょっと西洋医薬も治らないところがあります。こんな状態ではね、いわゆる自然医学ですね、向こうでもとても注目されています。ちょっと後でDVD 皆さん見ていただいて、その中では4人の方を出演しています。1人は私ですね。もう1人は佐藤先生という カナダ・トロント指圧センター、日本人ですけどね、もう一人は、カナダの西洋医学の先生。ただしこの人はホリスティック医学ね。ホリスティック医学は、自然医学という、日本では漢方薬で、向こうは漢方薬だけじゃなくて、いろいろの創薬、いろいろ自然の植物とかね、精錬して、液体を作って、飲むという形になります。ホリスティック医学でね、向こうも割合対峙しています。あとはリフレックスオレンジというリフレックステラピーという足つぼのマッサージですね。これを向こうも流行ってるね。向こうで、私行ったところは、Qigongという向こうはほとんどはなかった状態で、だからもうその皆さんもものすごく興味があってね、Qigongということは、気を出して、日本でも同じで人を飛ばすとかね、それが気の治療とかとても注目されています。この番組の中でも私を、日本の生徒さんですね、気でコントロールしているという場面もあったんです。あとはね、アキュパンチャーですね。僕は私いた時も、やってる人また少ないです。今いっぱい出てきてますけどね。その時私はグオフというところが、私ともう一人台湾来てる人、2人でやってます。トロントもこんなクリニックは少ないですね。だから患者さんも多いです。病気もこの人はね、日本だったらアキュパンチ針行くと大体肩こり4つとかね、一般の難しい病気は多分いかないと思う。もうこの人は、アキュパンチはちょっとどんなことわからないから、どんな病気でも治るという思ったですね。だからその時いろんな患者さん、私に対してもいい勉強、いい経験になりますけど、たくさんの難しい病気の人も治療しました。それでその中で輸入の人はこの5つの科学、5つの自然科学の自然医学の治療項目をちょっと紹介しました。まずこの私録画した DVD、まず皆さん見ましょう。
Hello, welcome to The Best Is Yet to Come. This is something new. We've had good company dropping in today. Of course, you're always good company at home, too. You're always very, very welcome. But our friends here today and Bill Russell with his panelists of experts are going to deal with a question. We're going to look at a lot of topics that you'd like to know the answer to, you ought to know, and you need to know. Bill, how about take it away? Alternative medicine is our topic today. Bill?
Well, I have quite a panel up here, and I'm going to introduce them one by one, and they can each talk about their own particular field. And first of all, we have Dr. Leonard Levine, President of the Canadian Holistic Medical Association. Take it away, Doctor.
Good morning, Bill. The Canadian Holistic Medical Association is a group of physicians and allied health professionals which are involved in helping to educate people about body, mind, and spirit. We are a group of us who feel that not only do we use the template of Western medicine, the surgery, and psychiatry, and pharmacological agents, but we also are interested in using other things in our practice as well. Things like acupuncture, massage, shiatsu, many other modalities, particularly nutrition. That to me is very important. And people use and want to use nutrition as part of their lifestyle. We also support people to use a lot of old-fashioned remedies, things which your grandmother taught you, things which your family was passed down from tradition, from your old country, from people from Scotland or from Ireland, wherever it happens to be, and just the idea of sharing with your family health. And we have a magazine called The Hologram, which is part of the Canadian Holistic Medical Association newsletter, and this goes out to people 5 times a year. Our organization's about 500-600 people strong, and the magazine goes out to between 1,500 to 3,000 people across Canada, medical officers of health, MPs, MPPs, etc. So our basic organization, our basic direction is that of helping people help themselves, and we have an educational basis where we try to help people to learn how to help themselves. So that basically is what we're on about, and we feel that as medical doctors we need to support others to take care and help them with choices. And that, by and large, is what we're on about, Bill.
Well, now, one of the items that you just mentioned, Shiatsu, is practiced by Ted Saito. How about telling us about yours, Ted?
Yes, well, Shiatsu therapy is the ancient Japanese healing art. Its origination is in China, actually, about 3,000 to 4,000 years ago, long way back. And Japanese adopted, I guess, like around 12th century. It's really like legalized, what I mean, like Ministry of Health recognized in Japan this therapy around 50 years ago. Actually, last month we had the 50 years celebration. And schooling is a 3-year course. And of course, like in Japan, Eastern medicine, Western medicine go side by side. And sometimes like Western medicine won't help, and the doctor sent to Eastern medicine, which Shiatsu therapy, acupuncture, herbal medicine, so many other choice, I guess, in Japan. And the Shiatsu is one of the form. It's Shiatsu, simply translate Shi, Japanese word like finger, Atsu, pressure. So finger pressure therapy. Yeah. And actually, I brought it 1971, I guess, to Canada first time. And the last 20 years, amazing. I myself really surprised how grow so quickly, how accepted such a like healing art. And of course, acupuncture too, herbal medicine, also like reflexology, whatever. It's really growing. I think reason why I'm thinking always like Western medicine to me is not all. Of course, Shiatsu is not all at all. What we need really like sort of, like cooperation each other. And that's for the, of course, like patient side and helping each other. And the Shiatsu is really more like preventative medicine. This is real focus, strengthen your organs, and better circulation, whatsoever we can expect very well. And here the mostly patients coming for relieve the pain, but gradually, you know, pattern is changing. I can see it. More stress-related people coming, like insomnia, migraine headache, whatsoever, creating by the stress problem. Yeah, that is really, I can see now more and more population is growing and coming to us.
Now, Ted, right along with that, then, we have what Dr. Shen practices, which is acupuncture and Chinese medicine. How about it, Doctor?
Yeah, good morning. I'm from Shanghai, China. I studied the China and Japan. I'm the Chinese medical doctor and the PhD of the medical science. I'm mainly practicing the Chinese traditional medicine. This including the Chinese herbal medicine, acupuncture, and the Chinese massage is in China called the tuina, in Japan called the Shiatsu. And now the one called the Qigong. This is the Chinese, is the traditional the breathing and movement is the exercise for prevention of the treatment of disease. In China, you know, almost every hospital have the two kinds of the medicine. One medicine like the Western medicine, the same Canada. One is they use the Chinese medicine. So we always use a two-way for treatment of disease. You know, in China about have the 4,000 or 5,000 years the history about Chinese traditional medicine. The Chinese people very like the Chinese medicine. Now in the world, the many countries, people want to find some natural treatment way. So now in the world, the many countries, they use the Chinese traditional medicine. You know, this is the Chinese medicine always use the natural way. For example, they use acupuncture. For use a needle or use a mongosa for stimulation some points for the improve the body. You can relieve some disease, improve disease, also can prevent disease. Also, we use the Chinese the traditional massage. Like Shiatsu, you can do something for the relaxation or treatment some disease. Also use some Chinese herb. In China have about 3,000 different Chinese herb. So use the herb, now they make the herb, make some of the products, you know. So the take it, now many people find that the Chinese herb haven't big side effect. The leader can help the health do some treatment of disease.
Now then, perhaps Mona Leedale, our certified reflexologist and herbalist, has a specialized form of that. Would you like to talk about yours, Mona?
Yes. I took my training at the College of Natural Healing in Ottawa, and just like to tell a little bit about what reflexology is. I brought a chart with me today, so everyone can see that. And reflexology is another of the natural healing arts, as we've been talking about Shiatsu and acupuncture. And the basis behind reflexology is there's points or reflex points on the feet that correspond to every organ and gland in the body. So by touching points on the feet, as you can see the different organs mapped out here, you can affect change within the body. It helps to release tension from the body, as Ted had said about a lot of people coming for stress and relaxation, and I find the same thing, that most people come for releasing of stress, and a lot of the stress is causing a lot of imbalances in the body. So reflexology helps to balance the body, bringing circulation to all the organs of the body, releasing tension, and therefore reducing the stress on the body. There's also not only physical points, but also the emotional body is affected. And I'm sure that's the same in the acupuncture and the shiatsu and other natural healing therapies, is the emotions, a lot of the emotions that we keep within are released through working on the feet. And this helps the person feel a lot better about themselves and a more peace of mind generally. So I find most people just feel more relaxed and better about things, and they start doing things that they really want to do. So.
Well, I can see that the four of you will probably be generating questions. We're going back to Teddy now.
All right, you've heard from the panel of experts on alternative medicine, and after this break, what we're going to do is come back and give our friends here in the audience and the panelists a chance to consider why people do turn to alternative medicine. See you in a moment.
Mona, I'm going to put a question to you. Why do people go to alternative medicine?
Well, I think a lot of people want to take care of themselves. They want to learn a bit more about their body, and they might have tried a lot of other things and nothing worked, and they've heard about reflexology or different alternative methods, and they want to give it a try. And my business is just really built up with word of mouth. So when someone has had good results, then they pass it on to someone else, and then they come. People feel that they've gotten results, they've solved the problems that they had when they came, they feel good about themselves, they feel relaxed, and they can come on an ongoing basis as a preventative method.
All right, now, prevention is the thing that is fascinating here, and Dr. Shen, you brought a video, I believe, with you that shows how you operate, correct?
Okay.
Maybe we might just see that, and if you'd comment as we watch.
Okay, thank you.
Very good. Now there we see Qigong.
Yes, this is called the Qigong.
Right.
Yeah, in Chinese medicine, including the 4 parts. The one is Chinese herbal medicine, one is acupuncture, one is the Chinese massage, in China called Tuinai, in Japan called the Shiatsu. One is called Qigong. Maybe this is a new term to Canadian people. This video that I send the energy, vital energy to some other people. Little this lady is moving. In China, the Chinese medicine believe the qi. The qi is the vital energy. cycle in the body. So have the meridian and some acupuncture points. If the qi is stronger, you can keep the health. If you have some disease, if you make your qi very stronger, so can relieve the disease, improve disease.
But the point is, what you have done with people, they can carry on themselves.
Oh, yeah.
That's correct?
Yes, yeah. They say the Qigong have the two ways. One way is teach the patients for some exercise, breathing exercise and movement, for stronger the Qi. So can keep the health or prevent disease or treatment disease.
Now, this is fascinating. We're going to come back to this, but at the moment, we're going back to Teddy.
We promised you our audience could ask questions too. Edna, what is yours?
I'd like to know if acupuncture hurts at all, if there's any pain.
Does it hurt, doctor?
Okay. Acupuncture does have the two kinds of needle here. So here we can see this is Chinese needle. This is the Japanese needle. The Japanese needle little very thin. You know, when I put in some patients will maybe feel very little pain, but not too much pain. Many people are very afraid of the needle, like injection, but it's a different needle. When put in, you feel very little. Now I treat him here. The youngest the patient is 5 years old. He can stay the needle. I think that every adult can stay a needle. No, don't feel too much pain.
Now we're going back to Teddy again.
And Pat, what is it that's on your mind?
Well, I'd like to know how you manage to get to these doctors. Is it covered by HOHIP? What's your referral system? In general, how do I get to go to you when everything else seems to have failed?
Good question, yeah.
People in my organization, the Canadian Holistic Medical Association, we have an office in Toronto in 491 Eglinton Avenue West. And people can call us up at our telephone number 485-3071, and we can refer to other physicians, MDs and non-MDs, who practice holistic medicine. So that's how people get to us. And often, as was said a few moments ago, people get to us by word of mouth. Because people know in holistic medicine what we're on about is preventive medicine, helping people to help themselves. So maybe that'll answer your question a bit.
Now, you talk about referring to MDs. Do you ever have MDs refer to you?
Well, I am an MD.
Oh, I know you are, but I'm talking about other MDs.
Yes, they do. There's people who refer to, like I also do acupuncture. I also do some orthopedic medicine. My colleagues in Ottawa and Toronto refer patients to me, and I refer patients back. And I also refer patients to people who are non-MDs, because we can work together. I mean, the idea is to share, and the most important thing is that you get better. I mean, that's it. That's the name of the game. And to give you the tools to get better. I mean, that's what we're on about.
Teddy, has she got any more questions?
I have, or John has. John, what's your question?
Well, I want to know about reflexology. Mohawk has a course. If I took it, could I use these pressure points, as you mentioned?
Reflexology, you could use the points you would learn in the, I think it's a one-day course at Mohawk College.
Yes, it is.
Yes, they have a one-day course, and you can learn most of the points on the feet, and they would give you a chart, and there's lots of books out. It might be hard for you to do it on yourself, depending on how mobile you are, but you can also use your hands. And if you took somebody with you, you could do it on each other.
Thank you very much.
You're welcome.
Now, I still come back to a question that we started with. Why people come to you? Now, I'm opening up a point of controversy here, but is there dissatisfaction with Western medicine? How about it, Doctor?
There is definitely some dissatisfaction with certain types of Western medicine. I think Western medicine per se deals primarily with the acute care. It really does the penultimate in care of acute care medicine, Western medicine. However, when we're dealing with the chronic problems, then there is room for improvement as far as I'm concerned. And that means we need to turn to alternatives. And I feel that as we medical doctors gain more experience in dealing with alternatives, we are gathering more expertise to help our people. I think, does that answer you? Because that's the direction we're moving in right now.
Very good. Teddy?
More questions later, Bill, from panel and also maybe from the audience, just after this break. You stay there.
commercial break, you'll notice that Ted Saito has left us. He is now practicing Shiatsu on one of our audience. And Dr. Levine, would you mind mentioning what is he doing? He's describing it.
Well, what he's doing is basically trying to create some balance in the body energy. That's primarily it. There are certain lines of energy on the body. And Ted's working on these lines of energy. If you remember the old Christmas tree lights, they were hooked in series. And when those Christmas tree lights went out, you'd have to find out which one it was, and you'd plug in the proper light, and all the lights would go on. Remember that? Well, that's what, in a way, a very simple way of explaining what Ted's doing. He's pressing on various pressure points on the back. And where he's working right now is on the bladder meridian, and also the large and small intestine meridian in the back. And he presses on the points. And they're called tsubos. They're called points of energy. And when you press on these, you release the energy, so by and large, you create a more harmonious flow, a more harmonious balance of energy in the body. And you follow the energy lines around the body. There are energy lines in the back, on the legs, on the front of the body, and primarily by pressing these, and you're just massaged very gently, and you will release the energy from these points. So that's basically what he's doing at this time.
Is this covered by OHIP, Doctor?
This is not covered by OHIP. However, there are certain insurance companies which do cover massage, and this is a type of massage, and therefore it can be covered that way.
Well, we're going to let Ted carry on with that, but I think Teddy has a question for us.
Yes, I do. Ruby is sitting beside me, and Ruby, you feel very strongly about a choice of alternative medicine. Why?
Yes, I do, because not most, but some medical doctors just look at senior citizens and they just think we want attention. They don't think we ache and pain like we do.
And you think sometimes that you don't get the attention that you need?
We certainly don't.
All right. Thank you very much, Ruby. And I'm going to turn it back to Bill again now, to the panel.
Well, I know in our discussions prior to this program, we were talking about this business of dissatisfaction with Western medicine. I hate to bring it up again, but tender loving care seems to play such a tremendous part in this whole process here of alternative medicine. Would you care to give a little wrap-up capsule comment at the end, Doctor?
TLC, that's the way to go. You've got to touch your neighbor, you've got to feel your person, you've got to communicate, and your hands is one of the best ways of communicating. In my practice, and in many other holistic practitioners, we feel it's so important to touch somebody, so important to relate that type of energy that caring comes across to somebody when you touch them.
Well, it's like the epitaph that was on the gravestone of the hypochondriac that said, "See, I told you I was sick." Dr. Shen, how about you? You would agree, tender loving care is important.
Yeah, I think the Dr. Len said that the body has the chi, this energy. This energy is very important to our body. So every treatment, acupuncture, the shiatsu, for improve the chi is moving.
And this touching, this contact, and you do it too, Mona, that's very, very important as well.
Yes.
それではDVD 見ました。皆さん申し訳ないけど、英語ですけどね、大体様子とか風景とかよく、ご理解できると思います。中ではいわゆるQigongとかね、Acupuncture、指圧ですね、ホリスティック医学とかね、足マッサージとかね、この人とても興味があってですね、私はカナダも離れてもう20何年になりましたから、またこの番組見てでね、印象はとても強いと思います。だから我々東洋の人に対しては、東洋医学とか中国医学は当たり前のことですけどね、それで我々は東洋の人に対しても、東洋の医学ね、もっと、大事にしなければいけないと思います。前回も皆紹介したアメリカでこのいわゆるセラピックタッチですね、我々気候と同じの治療法をちょっと流行っているという、それとも日本でももっと大事にしなければいけないかなと思います。ただ一つの参考でちょっと皆さん紹介しました。また次回の動画でまた会いましょう。はい、ではさようなら、バイバイ。 welcome every month.